Hello, I'm Dr. Elizabeth Zhang, and I'm an ophthalmologist and oculoplastic specialist. So my patients often ask me about artificial tears and which ones to use. I also do recommend artificial tears to a lot of my patients. So I do recommend Sustain and Refresh as being good brands, but there's lots of different brands of artificial tears, and I think any of them can be just fine. Even generic artificial tears can work well. Different artificial tears do have different consistencies. Some are a little thicker, some are a little thinner. There are different ingredients that go into different artificial tears. So there is a little bit of experimentation involved, finding one that works for you very well. I've had artificial tears that, that I love that my patients don't like, and other ones where, I don't really like, but my patients love. So it's really about what feels good on your eye. Now, you want to avoid Visine or anything that says get the red out or maximum redness remover. The reason why is that these drops have something in them that actually constricts the blood vessels on the surface of the eye, and that's how it gets the red out. But if you constrict the arteries on the surface of your eye, then your eye actually gets less oxygen, and this irritates the eye over time, so that when that drug wears off, your eyes will actually become more red. Then people will typically put more Visine in, and it's just a bad cycle. So stay away from Visine or anything that says like maximum redness remover or get the red out. So artificial tears come in two different flavors. There are artificial tears in like a bottle type of, usually there's it's these little bottles. And so these artificial tears do have preservative in them. And so if you are using these type of artificial tears, it's just fine, but don't use them, I say generally more than 4 times a day, because if you put too much preservative in your eye, that will irritate your eyes as well. Then there are other artificial tears that are preservative free, and those tend to come in these individual kind of vials. And these are really great because you can use them like all day long. After I had eye surgery, I was using artificial tears literally like every 5 minutes because my eyes were so dry. And you can do that with the preservative-free artificial tears. Just typically, maybe 6 to 8 drops in each of these vials. And actually, you can take this cap off, and they usually do stick back on so that you can keep in your pocket and use it again throughout the day. But if you do find it in your pocket and the cap's already been off and it's like another day, then you want to toss that because there aren't preservatives in there. So it's only good for 1 day after you open it. So I do recommend artificial tears for anyone with dry eyes to help lubrication. And the other thing that can help is just using an actual ointment or gel. There's Systane gel, Refresh PM, or Lacrolube, and these are all good ointments that you can actually put on the surface of the eye. Now, it takes a little practice to put just a little bit amount of these gels or ointments so that you don't really blur up the vision. A little goes a long way, but if you can learn how to put just a little bit of ointment, that actually can really lubricate the eye and really feel good for quite some time. I personally do have dry eyes, and so when I go to places like California, I typically do make sure that I have some ointment because sometimes the tears themselves are just not quite enough. So hopefully that was helpful information for you. If you'd like to learn more about me, you can go to my website, www.dreyla.com. I'd appreciate if you subscribe to this YouTube channel so I can keep bringing you more information about your eyes and eye health. If you do live in Northeast Ohio and are looking for someone to take care of your eyes, I'd love to have you as a patient. At time of recording this video, I am accepting new patients. Thank you.